Alright, you guys might think that I'm crazy because I just 3 videos on a row. I'm going to try to make this short. So here's the thing. I'm taking a class, I already shared that with you. It's called Biofeedback. It's Applied Psychophysiology and Biofeedback. And I already told you guys that, PhD or SID or doctoral degree, you have to do, I'm not sure it's SID you have to do, you have to do a dissertation, which means that for my case, I'm going to have to come up with a completely new research on a completely new topic where the other doctors had not investigated yet. Or I could try to replicate. I could do that, but that's not what you should do. You should, as a doctoral student, create a completely new research. And in the field of psychology, that's what I have to do. And I want to do something with the weight loss surgery patients. And so I might change this down the road because I'm just, in my first year. But I'm taking this biofeedback class. So biofeedback is, it's a type of therapy that they do, that they will treat people who have chronic pain, irritable bowel syndrome, anxiety disorders, insomnia, and I have insomnia, so I'm going to be, practicing with a friend. She's going to be my doctor, I'm going to be her doctor, and treating her anxiety. And because they were talking about anxiety disorders, I thought about, well, weight loss surgery patients are, we have some kind of maladaptive relationship with food, let's put it this way. And we are seeking, or the weight loss surgery was a physical way to stop us physically from eating the foods that we could not stop ourselves from eating. The problem is that along the way, we all realized that, well, weight loss surgery is just it's a third of the solution. We need the exercise, and we need to work on our emotions and our psychological reasons why we started eating in the first place. So I know many of you guys, it's not my case, many of you guys don't have emotional eating problem. I do, or I did have an emotional eating problem, and I would link stressful events, I would want to eat, or it usually was stressful events. If I was sad, I didn't want to eat. I was too happy, I didn't eat because I could not stop myself from eating. But happy events, it's linked to celebration, and people go to dinners and eating and whatever. But it was mainly, for me, linked to anxiety related, for whatever reason. So it could be a trigger, my case, financial trigger, or a powerlessness type of feeling that made me anxious, and I wanted to eat. And what makes us want to do that is probably sometimes to numb or to avoid. It's called avoidance. You turn to something to avoid that feeling or that situation. I don't want to feel that anxiety and that horrible, stressful and uncomfortable feeling that situation is bringing me. I don't want to think about it, but I'm still anxious. I'm going to eat, or I'm going to drink, or I'm going to use drugs, or I'm going to gamble. So that's escape that a lot of people do. And for weight loss surgery patients, I believe that eating is the drug of choice. So biofeedback will measure your physiological symptoms and your physical signs. So let's say you are anxious, you might experience increase in heartbeat. You might experience perspiration. You might have high blood pressure. because when your heart or your breathing, it's out of sync. So there's little things that happen that they call the mediators. It's something that's you're going to do to mediate between your physiological stress and your physical symptoms. So you are stressed out, that's your physiological part of it. I can't remember the word now. And then you have a physical symptom that is, you're going to have your heart beat faster, and you're going to, you're going to you have sweats on your hands and stuff. So we hook you to this machine, which is just almost like what you have when you have a heart. It's an EKG, I guess it's called, when you measure your heartbeats and all. So we're going to measure how much perspiration you have on your fingers. You're going to measure what your heartbeat, and then we're going to measure your respiration, believe it or not. How much CO2 you are letting out. Because people think, well, oxygen, it's what we need to survive, but actually the CO2 is also important to regulate a lot of your systems. So we measure all that, and with that we are going to help you. We are going to help you have a pattern of, it's like exercise. You go exercise every day for an hour, let's say, because you want to strengthen your muscles. So the biofeedback is going to get all that information from you, and we are going to tell you, like, what is your pattern of breathing and how is that affecting your health in a way, and teach you a way to breathe that's going to help you calm down. Okay? And you're not going to do this every day all the time. You're just going to like train for about 10 minutes a day, so you kind of strengthen that muscle, your diaphragm, and you're going to train your muscles. So this way what's going to happen is that it's about your sympathetic and parasympathetic systems that, I'm having a hard time to understand that. It doesn't make any sense for me to explain that to you, but you're going to influence your body, your physiological part. That's going to help your health. So it's going to help you control the anxiety. It's going to help you lower the anxiety. We're going to teach you to cope with that in a more effective way, because sometimes people think, well, I get stressed out. I don't know how to control that. I don't know how to stop being anxious. I don't know how to stop my heart from racing when I'm nervous. I don't know how to do some things. And we are going to try to help you out with that. So my dissertation is that I believe that the emotional eaters, and I want to help implement a treatment with the weight loss surgery patients that's going to be in addition to the weight loss surgery, to help you have another tool. It is a tool just like the weight loss surgery. It's not going to be a cure or a solution forever. Like we have to work with the weight loss surgery tool that we got, we are going to have to work with that tool that is going to be offered with the biofeedback. So we are going to teach you some techniques to help you improve that. And if I'm not mistaken, that will also be with some CBT, which is cognitive behavioral therapy, and mindful therapy, which I found out that it's exactly what 9 minutes. I can't have to wrap it up. Which is, I always thought about, I am all about cognitive therapy, and then I figured out what I didn't know, that there's another theory out that's the mindful. It's mindful. I can't remember the words, but it's more like what I tell you guys all the time. It's more about being mindful about who you are, being more in the present. It's to don't give so much importance for the things in the past. You have to acknowledge them and I tried to work with them. So the biofeedback works with the more cognitive therapy to help you out. So I told this to my professor, and I told him that I might want to have my dissertation on how to implement biofeedback with weight loss surgery patients. And he said that because this guy, he kind of invented biofeedback. He's like it. And he said, well, there's no studies about this. They made some studies that they want to try to find a correlation between obesity and biofeedback, but not weight loss surgery patients. And some of the sessions go from $150 to $250. And my professor said, well, if you could get some people to come, we can do this for free. Free. So what we would need to do is I'm going to actually later on, when I have more information, I'm going to talk to Wendy and see, you know, what I can do to work with the Weight Loss Surgery Foundation of America to try to do whatever I can to help, and also to have them help me, because the way that I'm going to be able to help anyone in the future, or even you guys, it's by you guys helping me now while I need to learn. So apparently the Doctor Who's doing this, and actually it is with UCSD. We have they have a department there that does the lap band surgery. Probably he said lap band, but probably there's all the others. He probably doesn't know. Well, if you do lap band, you probably do all the others. So I'm going to try to hook up with UCSD to work with the weight loss surgery department there and see what I can do. So I just want to give you guys a heads up. If anybody's here in San Diego, if you're in Orange County, if you want to, you know, spare, it's like a couple of hours, like maybe twice a month or once a month or something like that, and we can, and I can work with the patients, and I can work with you guys. We can offer you free treatment to try to, you know, do something to not prevent, but to offer you a tool. That's how I see it. I don't see it as a cure. None of these therapies would be a cure unless you work with it. Whatever treatment like of this sort, you have to work with it. So if you want to help me out, and if you want to see if this tool can help you, so contact me, let me know what you think. And this is not, it could be right away, you could be like pre-op, you could be post-op, it would be really good if you are somebody that is struggling with anxiety and overeating, or especially if you identify yourself as an emotional eater, because usually it's stress related. It's some stressor that happens to your life that leads you to eat. So let me know, because psychology is my passion, and working with weight loss patients, weight loss surgery patients, it's another passion. So if I can combine both, it's going to be awesome. It's going to be awesome. So that's that, guys. I am at 14 minutes, and that's going to be hard to upload. So I will be talking to you guys later, and I really hope that I can, you know, in the course of my PhD, I can come up with something that can be used as a tool to help us, because of course I want to help you guys, and I want to help myself, and whatever I can do. Seriously, I am looking forward to that. So I love you guys. I'll talk to you guys later. Bye.